I think when you talk health, you see many people will talk about KEMSA. They'll talk about NHIF. They'll talk about universal health.
They'll talk about the medical equipment scheme.
The medical equipment scheme. They'll talk about the containers. I think health has been riddled with corruption. And that's why a lot of Kenyans actually see health as not having worked. I think in terms of NHIF I questioned how we are starting NHIF and going universal without biometrics because we were all very aware that Kirinyaga Road will be on overdrive to preparing all these invoices, and it did, as you saw. When we talked about we saw the universal healthcare being launched and piloted in the first 4 counties. You see, universal healthcare has not worked anywhere in the world. I think it's some form of it, but not like a full universal health, because it's too expensive and has to be there has to be a way for the private citizen to also be able to pay for there. So it was piloted and we never got the results of the pilot. Of course, the KEMSA scandal left everyone wondering what happened. It was August last year. It's over a year later, nothing has been done. So again, but when I think of health, I look at 2 things. One, the handling of the COVID period and the COVID crisis, which personally I feel has been handled well by the government from a health point, not an economic point. In that even we saw the increase in the capacities in the hospitals, both at the county and the national level. We saw a lot more preparedness than we had expected, and I think we handled the crisis quite well, and I think we are continuing to handle it quite well. So on that, I would laud the government. I feel that health, just like the Honorable CAS has said, health, I feel, is one of those sectors that should not have been devolved, or if they will have been devolved, not permanent, not fully as they did. Because again, while personally I know when I'm governor of Murang'a, I'll handle health very well because of having understood and engaged with the stakeholders.
What did you do? How would you do it?
You see, the issues of health, as you're saying, issues of capacity, have lacking the proper and adequate medical personnel. And motivating them enough for them to, and also being able to even supervise, ensuring that you have medicine and drugs in all these hospitals, and because what happens is really everyone just comes, they get the prescription and told go buy the medicine, even the Piriton and paracetamol are not there.
Most of the governors are complaining that that's because you're first restricted to buy from KEMSA, which may sometimes not have the required deliverables that you need at the time, but you're restricted by the law to buy from them.
Actually, most don't even buy from KEMSA. What they do is they accumulate some pending bill at KEMSA, and then KEMSA blacklist them, and then they start buying from private pharmaceuticals. So that's so. Actually, they don't buy from KEMSA. They buy about, and even when you go to KEMSA, you probably get allocated probably about 50% of your orders. So you still have room to buy from others. The issue had been actually the funds that come from the hospitals are not directed back to the hospital. I think that was supposed to be cured in the finance bill last year, which then was saying that this money needs to be translated and transferred straight back to the hospitals, the funds that are collected to ensure that there's proper flow of the same. I think the other thing that we need to look at is the infrastructure. We have a hospital in Murang'a that was started in 2010, Kerwara Hospital. To date, the budget was about 200 million. To date, it's never been completed. I think they've allocated so far 100 million from 2010. So then what we've left is we've left everything to the governor's priority. Yet it's actually about the people. When you go to the counties, when I go to the counties, everyone is telling me, can you organize for us a medical camp? We should not be having medical camps. And medical camps are just coming in to cure an inefficiency of the county system. and of the national health system. So because the whole thing is devolved, then you find that the national government also gives it a bit of an arm's length in terms of engaging on it. And that's why probably my feeling, I think even then when it was being devolved, and you remember it was the last one to be devolved, and even up to now, I feel that health should be one that the government, the national government needs to play a bigger role in. We also need to look at the issues of how the counties can benefit more from the NHIF through capitations in their own administration, and how to get more of this elderly population actually onboarded on the same. And then finally, I think there's a very big role that is supposed to be played by the private sector on health. I look at all these counties, and particularly in central Kenya, NCDs are a big problem. Your diabetes and other the non-communicable diseases. But we actually do not have any institutions, private or public, that actually are accessible in the region. Yet we do not have a way that we do not have. I have not seen any efforts from anyone on how to bring in the private sector players. We're talking about cancer being a huge impediment nationally and a big concern even at the local level. But again, there's zero investment in cancer care. And nobody is actually encouraging investors and giving them those incentives to actually set up such. So I feel the national government can play a bigger role in providing incentives for healthcare, both from manufacturing of the medicine all the way to actually setting up institutions of healthcare.
So what would be your score?
I'd also give it a 7.
A 7?
Yeah.
A 7.